Oops. All righty. Good evening, everybody. I'm Dr. Gigi El-Bayoumi, the founding director of the Rodham Institute, and also a professor of medicine at George Washington University School of Medicine and Health Sciences. I am really delighted to have our esteemed panel today. We will be discussing a really important topic on the air that we breathe. Before we do that, let me just first of all tell you that there's been a lot going on. I just returned from Cairo, Egypt. I was there actually for 2 weeks, looking forward to hopefully creating a relationship with one of the emerging medical schools there. More about that in some future time. Really had a lovely, lovely time there, and I'm happy to be back. I want to announce that on May 12th is going to be it's going to be our 10th year as the Rodham Institute. And because of COVID, it's probably going to be our 8th or 9th summit. I can't keep track anymore. But it's going to be about preparing for the new hospital systems and the new healthcare systems in Southeast, preparing our workforce. Just to remind everybody, this was the #1 issue that our community partners spoke about as their priority in terms of the new hospital systems and the healthcare systems. In addition to Universal Health, which owns GW Hospital, there's also going to be Whitman Walker Health. We know that Iona Senior Services is there. The Universal Hospital is going to have a very tight relationship with Children's. And we have over 160 community partners, and they've all spoken very loud and clear about what their priority is. It's not enough to have new bricks and mortar. It's really important to have a healthcare system where the people that work there are the people that are from the community. So we're really excited to have some of our experts, not only in the rest of the city, and of course, our own university, but also from the Department of Employment Services and from other people around the region, because there's some wonderful models that are happening out there. Well, without further ado, let's get to our panel today. And thank you so much for joining us. And you're gonna have to, cut me some slack today, because we're usually very relaxed on these panels, but I'm going to ask each of you to introduce yourselves, if you don't mind. We'll start off with my friend, Professor Lynn Goldman, who is the Dean of the Milken School of Public Health. And I have to tell you, I have been at GW now 37 years. I remember when it was just really a twinkle in some people's eye. And now it is one of the top 10 best schools of public health in the country. So, and that's no small part to Dr. Lynn Goldman's just amazing leadership. So welcome, Dr. Goldman. Can you introduce yourself briefly?
Sure. So it's great to see you, Gigi, and it's great to see all of our panelists here. I am Dean of the Milken Institute School of Public Health. It's our 25th anniversary this year. Very exciting. My background, I think, relative to this panel, I am an environmental health scientist as well as a dean. I'm a pediatrician. I've devoted a lot of my career to research and policy and other efforts around protecting children from environmental hazards. But that inevitably has gotten into issues that are very deeply embedded in social inequity and even racism. When I worked for the state of California in my first career, I established our lead poisoning prevention program. And we had to go door to door in neighborhoods in California to prove that there was a lead problem in the state, because many people thought, oh, not in California, this is an East Coast problem. And then I was at EPA, where I was responsible for the programs that regulate pesticides and toxics. And we were actually able to change the nation's pesticide laws to require that children would be protected, but that also that people would be protected across the spectrum of dietary exposures. And that's just so important, because diets are very variable depending on race and ethnicity and your culture. And so I I really think that I do bring some things to this conversation from all of that, in addition to being a dean. And I thank you very much, Gigi, for inviting me.
Thank you. And I forgot, Ms. Ashanti Carter, who is the program manager, is the one that actually helped organize and put this panel together. So thank you, as always, Ms. Ashanti. Ms. Abby, would you please introduce yourself and welcome?
Oh, sure. Hi, everyone. It's such a pleasure to be here, Gigi. Of course, we meet once a month, as you know, with the DC Healthy Housing Collaborative. So I'm Abby Charles, and I work for the Institute for Public Health Innovation. We are the Public Health Institute for Washington, DC, Maryland, and Virginia. But we also work very closely as one of the partners with the DC Healthy Housing Collaborative, which is a collaborative of organizations focused on addressing the intersections between health and housing in the District of Columbia. So we work with government agencies, community-based organizations that are doing housing work, remediation, as well as organizations that are doing health work and really looking at the intersection of asthma, the issues related to lead, carbon monoxide, and so many other issues that could affect people's health as it intersects with housing. So excited. My work also focuses on community health workers and the role that community health workers play in ensuring that our communities get access to information. And of course, we also focus on racial equity. So ensuring that we're doing racial equity impact assessments for all of our strategies, whether it's related to work in environmental justice or our work in housing or otherwise. So excited to be here and for this discussion on pollution and how it impacts our families and communities.
Well, thank you. And your organization is just amazing, IPHI, and also the Healthy Housing Collaborative. I've learned so much. And, whenever any of us feel discouraged about life, just attend one of those meetings, because you see what good human beings there are who are like-minded, who are altruistic, who work hard every day, such as Ms. Abby, and to really bring these, have a focus that's holistic and not just sort of everybody siloed, but to really look at these issues in a holistic, comprehensive, and equitable manner. So thank you, Abby. I've learned so much from you, and I'm so happy to have you. We're happy to have you on this panel. Now, forgive me, doctor, please, I want to make sure that I'm pronouncing your name correctly. Can you please introduce yourself?
Absolutely, I'm happy to do so. So I'm Dr. Natasha DeJarnett, and I'm a professorial lecturer here in the Milken Institute School of Public Health at the George Washington University. And I am a session lead for the Environmental and Biological Foundations in Public Health course for the MPH online program. I am also an assistant professor of environmental medicine at the University of Louisville's Christina Lee Brown Environment Institute. And there I research the relationship between air pollution and cardiovascular disease risk, climate change, namely how heat is related to cardiovascular disease risk, as well as environmental health disparities. Previously, I served at the American Public Health Association, where I led our natural environment portfolio around air, water, and climate change, and was manager for the 2017 Year of Climate Change and Health, hosted by APHA. And then I also have additional nonprofit experience at the National Environmental Health Association, where I led research and climate change, as well as children's environmental health. Thank you.
Wow, so we've got a powerhouse for panelists today, we really do. There's so much to cover, but let's just start. Obviously climate change and quality air has been, having come from Cairo, let me tell you, which is, interestingly, they're going to be hosting, Egypt is going to be hosting the next climate change conference, which is ironic because Cairo is pretty polluted. I think that's also why I've got a cough, quite frankly, because I'm not asthmatic, but I actually had to use an inhaler while I was there. And my mother, who has never been a smoker, actually has some changes on her chest x-ray consistent with emphysema just from the pollution. And she has lived here in the United States most of her life, since the time she was 15, but just the exposures there. So let's start off. How important is the air that we breathe? Dr. Lynn Goldman, would you like to just sort of start us off, give us some context? I mean, you're a pediatrician as well, so why is this such an important issue? You're on mute.
It's an incredibly important issue, Gigi, as we have learned over time. Back in the day, in this country in the 70s, when EPA first started, we thought that only the pollution that was visible, the smog that you could see that was making it impossible, you couldn't see across Los Angeles. That was what was important in terms of air pollution. But as the science has developed over time, and particularly as we've learned more about children's health, we realize that lower and lower and lower levels of some of these pollutants are causing serious health impacts. What happens is, especially when we burn fossil fuels, that there are a number of pollutants that are created. Some of those pollutants create smog, and that's the pollution you can see. And some of those pollutants, although you can't see them, like the ultra-fine particles, the PMs that are really, really tiny, they're inhaled very deeply into our lungs, and they cause the kinds of symptoms that you actually described with your mother, as well as asthma for children. And what we realize now is that from conception onward, these pollutants are important for our health. They are involved with birth weight and preterm birth. They are involved with sudden infant death syndrome, with development of asthma, with chronic lung disease, and even with heart attacks as we're aging. And it's, as we learn the science, we realize that, things that we would have thought when, you and I were in medical school at Gigi, that these pollutants are actually able to cause clots to form, and in that way cause strokes and heart attacks. And so we know that we need to bring these levels of pollution down very, very low. But unfortunately, in most of the world, and this is what you're experiencing in Egypt, we don't have the right technologies for our automobiles. We're still using too much dirty coal without technology to remove the pollution from the air. But in our country as well, we have unfair distributions of these pollutants. So many communities have a very unfair share of air pollution, and that can be because of geography, just where the pollutants go, but it also can because of how we site things, that things that produce a lot of local pollution, like truck transfer stations, where are all the trucks going? Where are all the buses going? Where are they parking? They are concentrated in poorer neighborhoods. You don't see those in wealthy neighborhoods. So there's a lot of local generation of pollution, more freeways and more, even still utilities that burn coal that are impacting these areas. And now increasingly natural gas as well as coal, and that we haven't really switched to greener forms of energy production and transportation. So this is a global problem, but it's also very much a local problem, and especially in poor and minority communities, in traditional African American communities that are on the receiving end, not necessarily producing the pollution, but certainly on the receiving end.
Well, let's take it to a local level. And I know that, Abby, this is something that, your organization works a lot about. I mean, I was actually shocked to find that Southwest DC is one of the most polluted corridors in the United States of America. And, with all the gentrification that's happening, the Pepco stations there, gentrification only adds insult to injury, because all of these communities, and in Southwest, it was historically African-American communities with children and families and so forth, that are living in places with high pollution. And then you bring all the construction that they're having to deal with really no sort of protections at all. So Abby, can you kind of talk to us about the local issues and specifically around Southwest? Because,
Mhm.
you know, we like to go there to enjoy the great restaurants and, you know, so forth, but there's a very high price that has been paid by the residents, the longtime residents for generations in that community.
Yeah, and it's Southwest, but it's also other parts of the city as well.
Of
Um,
course.
Especially when we think about lead and asthma in DC. We find that DC has such high rates of asthma that are connected to the issues that we see related to air pollution, but also as it relates to just old housing and poorly kept housing, um, whether it's, because there's mold, there's pests across the city, but it's not affecting everyone equally, right? It's affecting people in low income neighborhoods. It's affecting people of color the most in the city. And that's largely because, when we think about DC, we see that there's more than African Americans, Black people are more than 5 times likely to show up with asthma than non-Hispanic white youth, right? And those disparities are exacerbated when we look at emergency room utilization too. And, we are not doing enough to address the issues that trigger asthma, whether it's in homes or in our communities. In Southwest DC, it's a confluence of factors, right? As Gigi, you were talking about, there's the factories that are in that area, there's the power plants that are in that area, and then there is also housing that has been neglected, right? Public housing that's been neglected, public housing that has not been transformed with the pace at which our residents need transformation in their housing. So a lot of the work that the advocates and community members who are at the table of the DC Healthy Housing Collaborative and also some environmental justice advocates are doing are trying to bring more attention to the needs of our communities and really trying to figure out what can we do from a policy perspective to affect air pollutants. One other factor that affects the impact of air pollution in the district as well has to do with climate change, of course, because as it gets warmer, the impact of those pollutants in homes that are, again, poorly ventilated, that were built years ago, just exacerbates the effects on children's lungs, on the lungs of our seniors and our elderly residents as well. So we need a lot of investment. And, there are a lot of advocates, but we still need more. And we'll talk a little bit more about advocacy later as well.
Well, I'd like to come to the issue of lead because Dr. Natasha, one of our big partners, one of our faith-based partners, which is Temple of Praise, we went and interviewed a number of people there so that they could sort of give us testimony on the health conditions of congregants and people there. And one of the people that we interviewed was a principal, and she spoke about how lead was impacting the children's learning and behavior and all kinds of things. And she called herself not a principal, but a glorified social worker, because she's having to deal with these issues that relate to racism and structural and social, determinants of health, which are really poverty, et cetera. And when I mentioned this to some friends in Egypt, they're like, there's no poverty in the United States. What do you mean lead? Lead is nothing, that's for old houses. So can you enlighten us sort of, Abby brought up an important point about policy. I mean, but yet the disproportionate number of children in schools in Southeast that are paying the price, which is not just a one-time price, as you well know, but a long-term price in terms of their education and their health and well-being. Can you speak to what your experience has been?
Thank you. So full disclosure, my association with lead has been mostly tangential, but it is during the time while I was at the American Public Health Association, I actually was a part of, because part of my portfolio was around water, I was part of the team that responded to the Flint water crisis.
Mm.
And when we think about environmental injustices, I think what's quite important is often that the voice of the community has not been included in the decision-making of what affects their community. And we can see that in a number of ways in the Flint community. And so in that experience, I won't say that we learned that not only is it a threat to in homes that have lead paint, for example, but it's also potentially a threat when it comes to lead service lines and our aging infrastructure across the US. And so this aging infrastructure, we also see differences in the distribution of this aging infrastructure across lines of disparity as well. So lead uncovers so many disparities. And further, you pointed out the heartbreaking aspects of lead, that it is neurotoxic and how that impacts populations from childhood through adulthood. And with children, children are susceptible in a number of ways. And I know I'm speaking to experts on children's health, but exposure during certain stages of development can have short or long-term consequences. And with lead, we're particularly concerned with the neurotoxic impacts that result there. Policy makes a huge difference when it comes to lead exposures. But going back to my original point, involving the community in the decision-making and the informing of this decision-making is critical, because what we know, also as Dean Goldman pointed out before, is that there's no safe level of lead. So the lower and lower and lower that we can reduce exposures, the greater the benefit is to health in the long term. And I also wanted to follow up on some of what Abby shared. I appreciate the discussion around the threats to health that exist in Southwest DC. And if you don't mind, I'd like to just share briefly a little bit about my story. And it's not DC related, but it's related to my experiences visiting my family in North Birmingham, Alabama. So I'm from Kentucky, mostly grew up in Kentucky, but I would visit my family in North Birmingham, Alabama as a child. And when I would visit, my asthma would flare up. And I said, why can't I breathe when I visit? I would start packing extra asthma medication and so forth, just for a visit. Now I understand that where my family is from was home to numerous steel mills and other industrial polluters, and some of which were right in the neighborhood of my family's. And though many of those industries are gone now, there's contamination that remains. And then also there are newer threats that have emerged where my family's neighborhoods are bordered by 8-lane interstates of I-20, I-59, I-65. My grandmother lives right on the flight path for the airport. You could always hear the planes fly right over her home. So just a number of air quality concerns. And in Birmingham, air quality remains 14th worst in the nation, according to the 2020 American Lung Association State of the Air report. But in the community where my grandparents live specifically, this community is 97% African-American. The median household income is about $22,000 to $24,000 per year. So you can see that the population is heavily a population of color, also a population of lower income. And when my grandparents purchased their homes, they were subject to redlining. So where my family's from is an area of environmental injustice. Chronic conditions persist there. Cardiovascular disease, low birth weight, other chronic conditions. Lead also is one of the exposures that this population faces. So this is one of the reasons that I found out that I couldn't breathe while I was there because of the poor air quality that was there. And communities of color are the most likely to live on the fence lines of industrial polluters. And this causes a higher burden of exposure to these toxins. And the single strongest predictor of where hazardous polluters are located is race. It's not age, it's not age, it's not education, it's race. And we make up the majority of the population that lives within 3 kilometers of a hazardous waste facility. We're 75% more likely to live on the fence lines of industry. So protecting our air quality would most greatly benefit those that live on the fence lines of these communities, like my family, like that of many others. So I just wanted to tag that in as well. I love what Abby shared before.
Mhm. No, I think that these stories are, I think, especially powerful because we can talk about statistics, and until they pop, and these are real human beings, such as yourself, such as specific children, you know, who are impacted and are not doing well in school, then it becomes just another abstract. But these are human beings' health and well-being. Yes, Dr. Goldman.
Yeah, I just would like to add a point about lead. I think sometimes people are so worried about lead that they're even worried about having their child tested, and how important it is to get the lead test. The lead test can tell you if there's too much lead around your child. You can do work, get public health in to do work to try to get the exposure to be brought down. That's so important. Then other children who might be in that environment later are protected. But also very young children, you know, their brains actually have considerable plasticity, a lot of potential. And that if a lead problem is identified early, and it's possible to then provide more enrichment for the learning for the child can make up for a lot of the damage that might have been done. These are not children to discard or to label or to give up on. You don't give up on children. And I'm going to use myself as an example. So I grew up in an area in the Gulf Coast in Texas where there must have been a lot of lead, because after going through college at an elite university, Berkeley, after going through medical school at UC San Francisco, after finishing a pediatric residency and working in public health, I had a position where there was a lab that did lead, and they were showing off their lab to me, and they were, well, let's run your sample as a control, right? So my blood lead at that point, after all of those years, was 14, which right now, well, at that time was not abnormal. At that time, I served on the committee to the CDC that lowered the standard from 15 to 10. Since then, it's been lowered again. At that time, that was considered to be normal. Now that's like a huge level. But you see, I had that level and I did all those things. And why? I grew up in a very enriched environment, not a great school, but a great family that made sure that there were a lot of things around me supporting me. Communities need to advocate for that for their children. That is so important. That, you know, not only have the lead testing, but if you've got the lead, what are you going to do about it? And the children need to have that enrichment. You know, I mean, look, Gigi, maybe I would have been Albert Einstein, you know, who knows? And the issue is that it's important to know, and it's important to do what we can to protect our children.
Right, right. Yeah. And you bring an important point up about adult and lead exposure, because I think that that's something that's a little bit of a blind spot for physicians that we don't tend to check. And yet we know that that causes behavioral issues. I'd like to focus on what you talked about, Abby, and that is really the community health worker piece. You know, COVID has taken us through so many changes. I think that as we look at communities of color or under-resourced communities, there are so many competing priorities. You know, there's housing, there's environmental pollution, there's health, there's education. Why is it that you're looking at community health worker education as a venue of, sounds like, both prevention and advocacy? Can you speak more about that?
Definitely. So especially when we think about pollution, you know, the EPA released a report last year that spoke to the fact that when it comes to pollution, we would usually think that income is a factor in exposure. But across the board, regardless of income, when we looked at race was the primary factor that led to whether someone had greater exposures to pollutants or not. In communities of color, especially where there are competing priorities, how do you get access to information about lead? How do you find the time when you are also working full-time, taking care of families, dealing with many other challenges in your community? It is the responsibility of the government, especially when it comes to public health, to ensuring the safety of their communities. And we see community health workers as a great partner for government to do the outreach and the education and provide the access that is needed for the communities who need access to lead testing, who need access to information about mold, who need access to information about pests and how to address pests in their home, who need connection to the advocates who will support them in addressing their landlords, that their, the tenants, their landlords that are shaping what the quality of their housing looks like. So we train community health workers on these issues so that they can go into their own communities as those trusted messengers and facilitate that information sharing. Be that trusted ear who that community member could speak to about the issues in their home and facilitate navigation to the services that they need to address those issues. There's not enough investment, and we need more investment in our communities themselves. Those same voices that Dr. DeJarnett was talking about. When we hire community health workers, we're hiring people from the community. So we're hiring the same people who have dealt with mold in their home to help their colleagues, their peers, deal with that same issue. And it's so important that we advocate for more of those workers, not only from a workforce development perspective and a community development perspective, but also because it is the true way to increase access and improve outcomes when it comes to health. So that's why we're training community health workers.
Well, and I have to tell you, during the whole, trying to get people vaccinated during COVID, one of our experiences at Rodham is that we actually worked with several community-based organizations where we did sort of a train the trainers. So they're the ones, we gave them the information so that they would be the ones when they were reaching out to their clients or the people that they served, they would be the experts that could answer all of the questions. And that does several things. That's not obviously unique to Rodham. And plus this was all of the universities working together to do this. This has been done all over the country, I believe. But I think COVID has been, with as many awful things that have happened, there has been a spirit of collaboration, of consortium building, of kind of going back to a time when that was I think more effective, so that there can be an increase in the capital, not just the social capital, but the educational and economic capital of communities. So I want to kind of shift gears a little bit and talk about what the role of universities and academics, and specifically GW, is, because sometimes I feel like we get off the hook a little bit. Yes, we're contributing to knowledge, but when it comes to our, communities that are in our neighborhood, in DC, what can we do? How can we leverage our voices so that we can, say, look at this as a matter of policy, but principle and morals and ethics. This is something that we consider important for the community in DC. What are your thoughts? Any of you?
I mean, I could start. I mean, I think that we can always speak, but I think it's important to do more than speaking. I think that people in universities like GW, and especially at a school of public health or a medical school, it's important to create partnerships with communities, and that those be very two-way, that there's as much listening as there is talking, and that work is not extracting resources out of the community. That I think that is absolutely critical. We don't want to use the community like it's some kind of a zoo, to take our students out to just see, to see how the world is. We want to make sure that whatever we're doing with communities is contributing more than we're taking back. And I think that's incredibly important.
I agree and would love to follow up on this. I love what you share about partnerships. I think that that is not discussed enough about the strategic partnerships that advance health, that support and engage communities, and listening. I love that you said that as well, Dean Goldman. So it is at least as important to listen as it is to talk. It might be more important to listen as it is to talk, especially when it comes to working with communities. And so I'm going to put my University of Louisville hat back on. And here in Louisville, Kentucky, our air quality ranks among the worst in Kentucky. And we also have high level of cardiovascular disease mortality. I think we're ranked 7th in the nation in terms of cardiovascular disease death. And so one of our answers to cardiovascular disease prevention is the Green Heart Project. So this project is partnership is at the core. So recurring theme, partnership. So it's supported by the National Institute of Environmental Health Sciences and the Nature Conservancy, but we have a lot of local partners as well as the community that contribute to the success of this project. But in our previous research, we found that exposure to volatile organic chemicals is associated with increased cardiovascular disease risk. And further, we found out that the places in Louisville, Kentucky that have lower tree cover, the population there has higher level of exposure to these volatile organic compounds. So this laid the foundation for the Green Heart Project. And what the project is essentially a randomized controlled trial where trees are the intervention. So we are planting trees, and then we're looking at air quality and cardiovascular health before and after tree planting. So tree planting started in October of 2021 and continues to today. With funding from NIEHS, I have the opportunity to add 2 projects to this study. So I'm adding a temperature monitoring network that will make our air quality assessment even more encompassing. And then with that, we'll be able to look at the relationship between increased tree canopy and changes in residential temperatures. And then also, I have the opportunity to look at health disparities within this population. So we'll be disseminating a survey on perceived discrimination and see if that toxic stress of discrimination changes the relationship between that we know exists between air quality and cardiovascular disease risk. But what I greatly appreciate about this project is that we've done a great deal of research into what trees will work for our communities and the methodology by which our population would most benefit from the trees, and that the community called for these trees. So I think that the outcome of this study will be not a blueprint, but a green print for other communities to follow to be able to increase tree canopy with the hopes of improving health and quality of health outcomes. So excited to share about what I think is a powerful university public-private partnership, but partnership at the core and health at the core.
Yeah. And so GW is one of the key partners and is going to be a resident of some of these wards that face a lot of disparities as it relates to indoor and outdoor air pollutants. So as a partner, as the hospital that's going to be built over in east of the river, we need that information. We need data collected as residents are coming into these centers to understand what is their experience with housing, what is their experience with exposure to mold, what's their experience with exposure to lead. So that data is going to be so critical, but not just the data, we need the voice of researchers. I know there's researchers like Dr. Janet Phoenix and others who are at tables with advocates, advocating in communities, but we need more. When we go to DC Council, Children's Law Center is always there, and we need more researchers who can provide the real data about what the experience is on the ground and who can make those connections to the issues related to health as well. So we need more voice. We could never have enough voices advocating for this issue in community. The other piece I'd say is, as Dr. DeJarnett said, research that is designed by the community that's most affected, right? And I know there are so many institutions that are doing more of that work. but I still get invited to tables where the research has already been designed, and then I'm providing feedback afterwards, as opposed to having it shaped by the community and truly using a collective impact model where the community is shaping what that looks like. I think is going to be really important as well.
I think, the key here is that the drivers of the bus are the community members. We serve at the pleasure of the community. We don't dictate what the priorities are. And to your point about listening, these listening sessions are so key. That's why it's important for us, for example, to go to the Ward 8 Health Council, which is once a month, where people, around the table can talk about various issues that we can really understand what the priorities are. Because let's face it, if our model of just saying, well, you need to do this, or this is the research, was effective, we wouldn't be in this mess. So I think it's crucial. I'd also just like to talk about something very exciting that's happening on our campus, and that is with the appointment of Dean Dana Matthew to the law school. She, along with Dr. Goldman, have really brought, I think, our university's mission to be more outwardly facing to the fore. As you may know, Dr. or Dean Matthew, I'm sorry, is looking to create an equity institute that would bring us all together to work together. And I think, it's not a coincidence, by the way, that it's all women, can I just say, that are doing this work, and the incredible leaders. But I think it is that kind of vision that, of course, Dean Goldman, you started, but now to get more and more people, especially for those, for us in clinic, I'll just give an example. In clinic, when we have somebody who has problems with asthma because their landlord won't fix, the thing, for a physician to even think about opening that Pandora's box to discuss these issues is a turnoff. But wouldn't it be nice, and we're actually have the medical legal partnership, the national one is actually housed in the School of Public Health, Joel Tattlebaum, but we're now creating RODM and this law school a new medical legal partnership, so that first we can teach our learners what is already going on over there before they set foot in any community. They're going to be coming to the Healthy Housing Collaborative and learning from you, Abby, and your work. They're going to be going to the Child Health Advocacy Institute, seeing what's going on. They're going to go to Breathe DC and work with Dr. Phoenix before they even set foot. And then they're going to ask, what is it that people really want before they create any kind of intervention? And I believe it's this kind of thinking that there's a critical mass. I'm feeling that this is a real opening for GW, that we're kind of taking it to the next level.
So Gigi, if I may, with all the new medical services that are going to be built in Washington, so far, there's nothing that actually includes public health per se, or some of the environmental health work. I mean, one, I want to talk Dr. DeJarnett just to moving her whole research program to Washington, D.C., because we need that so much. But the only place where public health even right now has a toehold is with Whitman Walker, because we collaborate with them on HIV/AIDS, and that's so critically important, but it's only a tiny piece of the whole picture. And, we really should have some of our air pollution expertise and nutritional expertise and people who are experts in some of these social determinants issues out there. And I also just wanted to do a plug, and forgive me for this, Gigi, but on April 20th, Dr. Wendy Ellis from the School of Public Health is going to be screening her film on truth and reconciliation in Cincinnati. And we are hoping, and Dean Matthews is very involved with this as well, that perhaps we can do a similar effort in Washington, D.C. Because I do think that it's retrospective in a way, but in a way it's not. Part of healing is recognizing what's been done in the past. We can't heal individuals without taking a good medical history, right? And we need to do that for our communities as well. And so I just hope you guys are aware of that. And if you, we're going to be screening it. There'll be a kind of a watch party too, but want to see you all there.
Yes, and we will push it to our listserv and we'll put it on our website. No, I think, you know, to your point about public health, I feel like public health, you know, is kind of an afterthought where it, just like community, should be there at the start. And perhaps, you know, this is an opportunity. We should have a summit about environmental health in, you know, and the, you know, what is the role of the institutions where we can partner with our, you know, our community to hear voices and then what they would want and what the roles of our various schools should be. But we, you know, long gone are the things where each person can do their own thing. It just doesn't make any sense. And furthermore, what I worry about is that with so much interest, economic interest from this side of the city, in Southeast, all of a sudden, people who have never been spoken to are going to be solicited for their opinion. And what I really feel strongly about is that we should not be nickel and diming people. We should have respect for people, and that we should be doing the work. And really, unless there is something tangible for them in terms of outcome where we are held to account, then it doesn't make sense for people to waste their time yet again, because they've said so over and over again. People have come in with their surveys, and then what? Nothing. So, you know, that's also why we have actually a leadership council that's comprised of both community leaders as well as academic leaders. And I think that that's a good model for all of our individual schools and our entire university.
Yes, I wanted to jump in, Dr. Gigi. We call that what you described as being culture vultures and poverty pimps. So we do not want to pimp out communities of color or just, you know, parachute in being saviors. So we don't want to do that. So everything that you've discussed, that is just excellent.
Well, thank you for that. Well, I'm going to share a little story about how, I won't say who, somebody, a colleague, research, wanted me to introduce them to the community partners that we had. And I actually used that word pimp. I said, I'm not a pimp. These are relationships that we've taken years to cultivate, and I'm not going to be there to just give out. I mean, what is this, you know? So I feel very strongly about that. And for those of us that do work with the community, we certainly take it as a very high honor, and it's something that we're very protective of. And it's really with the explicit permission of the community that we, you know, say, look, at this is something, or would you be interested? Can we help to accelerate or catalyze this? I think another thing that is very important that we're seeing actually happening in the community, I'm going to come back to Temple of Praise again. They're actually doing their own, they're building their own senior housing. They're also now on site. UDC is going to be giving courses on site. So there's a lot more of the economic development that's happening. There's a Mary Blackwell who has, I think, gotten 7,000 square feet in Ward 7, and in terms of the trying to get co-ops and people taught about, you know, aquaponics and hydroponics. And I see here that Ms. Octavia Shaw made a comment, and I can't read it because I'm wearing the wrong
I can read it. She said, thank you, Dr. Gigi. This is one of the reasons that you're very well respected.
Well, no, that's not what I wanted to talk about. Ms. Octavia Shaw and the Family Success Centers, because I've learned so much from the work that they're doing. They're doing incredible work. And really, we're all cogs on a wheel because we feel so, this is such important information. Please, I would like to sort of hear, I want to focus, you know, if you don't have any other issues that I want to bring up, but I want to be really specific and Abby, you can help us with this. You know, if you had the top 3 things that we should do right now to for prevention and advocacy as relates to environmental health, what would those top 3 things be? And we'll come around to Dr. Natasha and Dr. Goldman.
Gosh, number one, talk to the community that is most affected. So we talked about Southwest DC, we talk about east of the river. I think the number one thing to do from a prevention standpoint is to hear what are the concerns of the community and engage them in shaping the solutions to those issues. So that's number one. You know, based on the data, what we've seen is that asthma continues to be a challenge in the city. So dealing with mold and pests continue to be an issue. There are a number of programs that the DC government, Department of Energy and the Environment has to address those issues, but they address them for people who meet a certain income threshold. And then there are people who have higher incomes who aren't eligible to access some of those programs to remediate their homes, who might need additional support, who need additional advocacy for resources to be able to address their homes. So I think we definitely need to advocate for more resources for remediation beyond just those for the lowest income community members, but also for people who, you know, they're in that that middle space where they still can't afford to fix a roof, but it would be so essential to be able to ensure that their children can breathe, right? So we need to identify additional supports for that. And lead continues to be an issue. You know, DC has a lead pipe replacement program that they are implementing right now. You know, the outreach for that lead pipe replacement program, we could definitely use more. There needs to be more investment in getting the information to the families that need it most from an equity standpoint. It can't just be information that's on a website or on a flyer that's on somebody's lawn. We need active outreach, knocking door to door, having those conversations with families about what they need to know about lead, what the lead pipe replacement program provides, and how they're going to facilitate that. So we definitely need more outreach and advocacy to support that. As well. And then when we think about just in general, you know, just exposure to air pollutants in communities of color that are most affected by those air pollutants, how can we advocate with DC government to shift where those plants and where the sources of the pollution are located? You know, we talk about reparations. In some of these communities where there is this confluence of race and pollution, how are we providing reparations to these communities that have been affected by pollution for years? What are we doing to address that? The NAACP has a campaign that they're running right now focused on childhood asthma and lead exposure. So I'd encourage everyone to sign on to their letter that is focused on lead prevention in the District of Columbia and asthma prevention, which is really focused on these same pollutants that we're talking about. So I don't know if I answered your question, but those are some areas that I would say to prioritize.
Thank you. I mean, these are action items that I think are very important. You know, I was just thinking as you were talking, I mean, the Department of Employment Service, every summer, there are like tens of thousands of kids that are hired, right, and paid. And I was thinking, wouldn't this be a great project that they could actually be some of the ambassadors to educate on this issue? Because as you said, you need people there, and the kids themselves have a vested interest. Anyway, that's just a thought.
Yeah,
Dr. Natasha, yeah, what are your top 3?
I'm going to try to be really quick because I want to make sure that we get to hear Dean Goldman's top 3, as I am taking notes on the amazing insight that these experts are sharing. But as I was thinking about this, I was thinking climate change. We've got to address climate change. This is the greatest threat to health. This is worsening air quality. So I was thinking climate change and its relationship to COVID and other emerging threats, that it complicates our response to those and that those can be worsened by climate change. And then I was thinking in terms of health impacts, where I study cardiovascular disease. This is the top cause of death worldwide. It's the top cause of death here in the US. And I think that the traditional risk factors may explain about 70 to 80% of cardiovascular disease risk, but there's still underlying factors like air quality that contribute to cardiovascular disease risk that warrant more attention to help significantly prevent disease. I think there are 7 to 8 million people that die from poor air quality annually. And the major underlying cause of death for 70 to 80% of those people is cardiovascular disease. So I think these are really important threats to address. However, I'm not going to list any of those. I think that we need to address health equity. I think that we need to uphold environmental justice. Our communities that are most burdened need to benefit from the actions. I think we need to uphold health impact assessments and health policies and community-based participatory research as methods to address and to uphold environmental justice. And the recurring theme, the echoing theme, listening to communities, that communities and their lived experience is powerful and should be weighed equally with that of the expertise of investigators who will help support interventions. So those are the actions that I think are most important.
And last but not least, Dean Goldman, you have the final word today.
I think the other two said it all, but the way I would put it might be a little different. One is I think that we need in the US strong environmental agencies, a strong EPA and strong state and local agencies to crack down on pollution. And especially where people are getting away with breaking the law is in low-income and minority communities. It needs to be done fairly. I think we have a great head of EPA right now, my colleague, and I'm really excited about that. We also need strong global cooperation around climate and other environmental conditions that are really destroying the world. Somebody put in the chat the issue about the Amazon forest, and it's absolutely right. The loss of the rainforest is a terrible thing, and it's coming about because of the lack of global collaboration. Shame on us. We know better, and we've allowed this to happen. And our own country has weakened the climate treaties and weakened the negotiations, and we need to step up. But the third thing, and I think this links very much to what you heard, from both Abby and Natasha, and that is that none of those things is going to be done right unless we empower the communities who are most at risk. Those communities who are the most threatened by pollution are the most threatened also by climate. They're the ones that are flooding. They're the ones that are having the most serious impacts because the housing isn't right, because they are at the brink of where you have the sea level rise, the rivers flooding, the hurricanes hitting. And those communities need to be empowered, need to be engaged, need to have a say in how those other things are done, or the way that those things are done is going to once again leave them with an inequitable situation. But we need all three of those things. And I'm just really happy to be on this panel, by the way, with two people who are just such fabulous leaders in their communities to make those things happen. Gigi, this is great.
Well, on behalf of the Rodham Institute, I'd like to thank each and every one of you, Dr. Natasha, Ms. Abby, Dean Goldman, Ms. Ashanti, for this robust discussion. And it sounds like we need to have a summit, a joint summit, Rodham School of Public Health Summit on environmental health in our community, and maybe get some other people to work with us. Thank you for everything that you do on a daily basis. Thank you for participating today. For those of you that have not signed up for our newsletter or know of people who have not signed up, please don't forget to do that, and wish you well, breathe well, stay well, advocate. Have a nice evening.